Welcome, everyone, to Mettle Works Behavior Health. We bring you a new and innovative way to assist with managing symptoms of depression called Transcranial Magnetic Stimulation Therapy. What does it do? Our brains help manage our thoughts by creating pathways that communicate through electrical and chemical signals. Each thought or feeling is associated with pathways or roads that these signals travel along. So when we practice ideal pathways, such as being happy and relaxed, we are more likely to be able to trigger these feel-good signals at our own free will. How does TMS therapy work? Well, that's a good question. A magnetic coil is placed over the head and uses an electromagnetic field which provides enough energy to cause the neurons at the surface of the brain to reach action potential. This is a fancy way of saying the neurons turn on. And just like dominoes, those neurons send messages that cause other neurons to fire, which causes other neurons to fire, and so on and so on. This roadway of neurons reaches deep areas of our brain, specifically the limbic system, and works out those known pathways of our brain that are associated with being more happy, being less anxious, and being more relaxed and content. While a singular positive thought can practice a particular pathway once, a singular TMS treatment will practice that positive pathway 3,000 to 5,000 times. A typical course of TMS is around 30 sessions and stimulates positive pathways between 100 to 150,000 times. Imagine practicing jump rope or a tennis serve or a song on the piano 100 to 150,000 times. You get pretty good at it. It's just like mom and dad said when you were growing up, practice makes perfect. That's a lot like what TMS process is. The more your brain practices these positive pathways, the more of an expert your brain gets at feeling happiness and joy, and less of an expert it gets at feeling depressed. TMS is a non-invasive, simple outpatient procedure. There's no anesthesia, no need for hospital stay. During the visit, patients can listen to music, watch movies, chit-chat like normal with family or clinical staff. Patients drive themselves to our clinic, receive treatment, and then drive themselves back to work, school, or just go about their day as planned. The one great thing about TMS, because it is a non-systemic focal treatment, TMS doesn't have any of the traditional side effects of psychiatric medications, which have the potential to cause weight gain, sexual dysfunction, decreased sex drive, memory problems, nausea, or stomach aches, problems with sedation, blurred vision, and dry mouth. The most common side effect of TMS is a mild headache during the initial sessions, which disappears over the course of a few days. Most patients, however, report no side effects. Call or email to get your TMS treatment today here at Mettle Works Behavior Health.